So I get this question a lot. You know, we know that ovarian cancer is deadly. We know that it sometimes can be very scary. So what can I do about it? And unfortunately, we don't have a whole lot we can do, but there are a couple of things. One is making sure that you know your risk. And what I mean by that is know your family history. Make sure that if anybody in your family had breast and or ovarian cancer or colon cancer, that you want to take a look, and you might want to get some genetic testing, might want to get some genetic counseling, but definitely have that conversation with your gynecologist. In addition, we do know one of the things that you can do to reduce your risk is taking birth control. Taking birth control for 5 years or more, and it doesn't actually have to be sequentially, reduces a woman's risk by up to 50%. Now, is it guaranteed? Absolutely not. But is it something that can help? Yes. And it's actually one of the few weapons that we really have. And then the real thing is making sure that you know the signs and symptoms. And if you do have any of the symptoms of ovarian cancer, again, go to your gynecologist and make sure that they do a full examination, make sure that you're kind of keeping track of things and seeing if something's unusual for you, if you're bloated more than you usually are, if you're feeling full more than you usually do, or you have to go to the restroom a lot, you have a lot of abdominal pain, you want to make sure to get into your gynecologist right away. So while we don't have a whole lot in our tool chest, we do have a few things now, and that's a lot more than we used to. So we have some genetic testing that can happen. You want to make sure that you know your family history, and also knowing that your family history changes, right? Every year when you go back to the doctor, which you should, you want to make sure that you update your family history, because sometimes, you know, last year no one had breast cancer. Now maybe this year someone does. So that changes your family history. You want to make sure that's updated. And then again, birth control. Birth control for over 5 years can really help reduce the risk.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.